Hello, I'm Valerie Connor, and I'm going to present today on exercise therapy as an alternative to opioid pain relief. There was an article in the Courier-Journal last month about our opioid epidemic here in Kentucky. They referred to Kentucky's opioid crisis as a public health catastrophe. Kentucky's emergency responders are even experiencing something called opioid fatigue. This is from constantly reviving overdose victims, often repeatedly. The 2016 overdose fatality report by the Kentucky Office of Drug Control Policy state that overdose deaths are at unprecedented levels. The death toll for this is highest in Louisville, northern Kentucky, and yes, you guessed it, right here in Lexington. And it's not just street drugs like heroin. Over half of this year's overdose deaths involve fentanyl. This is a drug that we prescribe at the hospital frequently. Who does this affect? It affects anyone. Addiction doesn't discriminate. It's not prejudice. The article starts off by talking about a doctor in his second year of residency in the anesthesiology program at Johns Hopkins University who got kicked out of the program for his addiction. Everyone has a drug of choice, he says. For me, it was everything. Drug addiction doesn't just happen to junkies, people out on the street, homeless people. This is educated people, people that work alongside of us at the hospital, other nurses, doctors, people that should know better. Drug addiction can happen to anyone. True story. Last week, on my floor, a patient labeled as confused came to us from another unit. Apparently, when he came to the hospital, he was in pain. When he came to our floor at the cancer center, he was on a PCA pump, a patient-controlled analgesic pump, with a basal rate of 2.5 milliliters of 0.2 per ml of Dilaudid. That's a lot of Dilaudid. And then they had put a 100 microgram patch of fentanyl on him as well. No wonder he was confused. I'm surprised he wasn't comatose. Of course, we had to put him in restraints so that he wouldn't harm himself or others while he was confused. We discontinued the PCA pump and removed the fentanyl patch. And hours later, he was still reporting his pain at 0 on a scale of 1 to 10. Now, if hours and hours later his pain was at 0, is it possible he was prescribed too much pain medicine? Providers can help the opioid crisis by not overprescribing these medications. Last year, the Center for Disease Control, the CDC, reported that painkiller prescriptions have quadrupled since 1999. The amount of pain that Americans report has stayed the same. 40 Americans die every day from prescription opioid overdoses. Since 1999, more than 165,000 people have died from overdoses related to prescription opioids. Nearly 2 million either abused or were dependent on prescription opioids in 2014. Tom Frieden, who is a doctor and also the director of the CDC, states that there is no evidence that opioids control chronic pain effectively long term. The CDC has developed new guidelines for prescribing opioids for chronic pain. They also list 4 other ways to manage pain. Non-opioid pain relievers such as Tylenol, Motrin, antidepressants, anticonvulsants, cognitive behavioral therapy, changing our thoughts and behaviors related to pain, and last but not least, the one I'll be talking about, exercise therapy. Exercise therapy is a non-pharmacologic treatment for pain. The group of people that I work with are patients with hematologic malignancies, blood cancers, adult leukemia, lymphoma, and myeloma patients. They experience a great deal of fatigue. Fatigue is different than just being really tired. If you're really tired, you can rest and you feel better. Fatigue is when you're really worn out and sleep and rest don't relieve it. We used to tell cancer patients to rest and reduce their activity. And at different times during treatments, this is perfectly fine. But new research shows that exercise with these patients isn't just safe, but can improve their quality of life. If you would like to click on the link below that reads Teaching Handout Link, you can follow along with me as we talk about exercise therapy related to its benefits, symptom relief, and examples of exercises. How can regular exercise benefit you? Regular exercise can do a lot of things, like improve balance, which decreases the risk of falls. Keep muscles from wasting due to inactivity. It can lessen the risk of osteoporosis by maintaining bone strength. Weak bones are more likely to break. It can improve blood flow to your legs, which decreases your risk of blood clots. It makes you less dependent on others for help with daily living activities. It can lower levels of anxiety and depression, which have been known to increase pain. It can lessen nausea, and what cancer patient doesn't need help with that? It strengthens muscles around joints. It gives you more energy throughout your day. Our patients often struggle with insomnia, and exercise makes it easier to get a good night's sleep. It improves mind and body function, and especially important for these patients, it improves immune system function. It lessens fatigue. And last but not least, it can prolong your survival. Other cool things it can do is decrease your risk of your cancer returning. It can decrease your risk of getting another type of cancer. It can also decrease your risk of getting other chronic diseases. So what are some safe exercises for patients to do? Aerobic exercises like walking or swimming are good. Stretching and flexibility training in the form of yoga or Tai Chi. Light strength training like Pilates. Range of motion exercises. Resistance training. And everyday activities like vacuuming, grocery shopping, and walking the dog. Do something you like doing and something you enjoy. Find at least 2 things you like and enjoy and then alternate them so you don't get burned out. Start out slow and trust your instincts. Don't put out more energy than your body can handle. And don't start your training for the Boston Marathon. Keep your goals realistic. What symptoms can exercise therapy help relieve? It can help relieve constipation, mental fatigue, muscle pain, depression, anxiety, trouble sleeping, and lack of appetite, which is also a big struggle for our patient population. Now, you have to be careful with blood cancer patients. You're not going to exercise if your hemoglobin is less than 10 grams per deciliter, if your platelets are less than 50,000 per microliter, and if your absolute neutrophil count is less than 500 cells per microliter of blood. This is for your own safety. But keep in mind, immunocompromised patients don't need to be at gyms or fitness centers. Those aren't the best options. Those places can grow a lot of bacteria and fungus, and it's a great place for spreading germs. It's best to work out at home. If you go to Google and you type in Huffington Post 50 best free workouts, in the search bar it will bring up over 50 free workout videos. You won't want to start out kickboxing or doing turbulence training, but it does have videos on beginner yoga, and that's a great place to start. You could also ask your friends and borrow workout DVDs from them too. Depending on your cable TV package, you might be able to tune into a workout that is scheduled on one of your channels. Now that we've reviewed the material, let's touch on the goals and specific learning objectives. My target audience is adult male and female patients with hematologic malignancies. The goal is to educate patients on how to combat chronic pain from their cancers with exercise as they go through treatments, transplants, and get back to their life while in remission. For my cognitive learning objectives, patients will be able to list 3 types of exercises that they can perform to help with chronic pain, and 3 contraindications of exercise based on blood work from lab results. For exercises, earlier I mentioned resistance training, aerobic exercise, stretching, flexibility training, range of motion as just a few examples. For your contraindications based on lab results, I mentioned the hemoglobin less than 10, platelets less than 50, and at absolute neutrophil count, your ANC, less than 500. For my effective learning objective, patients will be able to list 3 benefits that they would like to receive through exercise and list 2 exercises they might enjoy doing. 3 benefits they might like to receive through exercise could be increased quality of sleep, prolonged survival, and improved balance. 2 exercises they might enjoy could be walking their dog and yoga. For my psychomotor learning objective, patients will research on the internet for free workouts, ask friends, or look at their TV schedule for a workout on TV. Next, they will start their workout routines. I know my teaching has been successful if my patients can name 3 types of exercises and 3 contraindications for performing them, if they can list 2 exercises they might enjoy and 3 benefits that they'd like to gain. Also, if they have researched the internet or TV and found a workout and then started their workout routine. Working out, according to the American Cancer Society, can lower your risk of cancer reoccurrence and improve your survival. Who wouldn't want benefits like that?